Welcome to the lie that measuring quality is about compliance. We are now entering that super tough conversation about what actually makes quality in an early childhood program. How do you know what is more important in a program? The environment or the educator? The relationships or the paperwork? How do documentation, inspections, and checklists automatically equal quality in an early childhood education program? Many states have quality rating and improvement systems, QRIS. Others have star ratings. Some have both. On paper, these systems are designed to determine what is quality in an early childhood education program. But what they often end up determining is not what is best for children or even what is best practice. What they determine is whether you followed a list of rules that someone not currently practicing in the field decided mattered. And sometimes those rules do not actually align with best practice. What begins as improvement often turns into compliance, and then something subtle happens. A lot of subtle things happen in early childhood, right? Quality becomes documentation. It becomes, if it's not written down, it didn't happen. If it's not in a binder, it's not real. The binder becomes the proof. The binder becomes the evidence. The binder becomes life. All hail the binder. Because if it lives in a 3-ring binder with tabs, color-coded dividers, and the right wording, then it must be quality. I love a good binder like anybody else, right? But children don't attach to binders. They attach to people. They don't regulate because your checklist is complete. They regulate because they feel safe and know. So the real question is, are we measuring what matters? Or are we measuring what is easiest to measure? Understanding how and why quality becomes synonymous with compliance is important because once we see it clearly, we can start having better conversations. And maybe, just maybe, we don't need to reinvent the wheel. Maybe we need to look more closely at the systems that already center relationships and continuity. Right? Right? So let's talk about compliance versus quality and how they became so deeply wrapped around each other in early childhood education. Because in ECE, the way young children learn is rooted in the care they are given, the experiences they have, and the relationships they build. But so much of the education system is set up to prove that educators are doing their jobs. And because of that, it became difficult for local, state, and federal systems to understand how to actually measure quality in early childhood programs. So what happened? Well, compliance, things like health and safety, paperwork, and programs looking the same in terms of materials and setup, became how both compliance and quality were determined. But in doing that, we pushed aside the very things that actually define quality: relationships with families, meaningful engagement with children, and environments that reflect the children in the space. This means that family childcare is often automatically not seen as quality because the standard became separate age groups, separate classrooms, lead and assistant teachers, rigid schedules, and environments that all look the same. And that is not what family childcare looks like. It also created a system that depends heavily on documentation, where the assumption becomes if there isn't documentation, then the educator must not be doing their job well. But documentation does not measure trust, relationships, continuity of care, or whether children are truly thriving. And that disconnect has real consequences. Educators are trying to do everything: meet compliance, complete documentation, follow systems, while also trying to do the work they actually came into this field to do, which is to be present with the children. And that leads to burnout. When compliance becomes the focus of early childhood education, children are not, they just are not, building strong attachments, social emotional development suffers, and educators leave the field, which means fewer educators who see this work as a calling. And the cost of that confusion is being carried by both educators and children. So now the question becomes, I know, I ask a question every episode: are we actually measuring quality or are we measuring compliance? Because this system, early childhood education, and the larger education system was not built on quality. It was built on compliance. And now in the present day, we are watching what happens when those two things are treated as the same: a diminished and stressed field. Now we're going to get into the receipts. Quality standards and compliance standards were always meant to be different. But that is not how early childhood education currently frames them at federal and state level. To understand how we arrived at the lie that quality standards are the same as compliance standards, we first have to understand the difference between the two. So compliance standards are health and safety standards. They are about making sure that children are in a safe environment and that rules and regulations are in place to protect them. especially during, emergencies, nap time, feeding times, all of those times. Quality standards, on the other hand, are supposed to be about how programs operate. They look at how care and education are delivered. They look at whether programs are providing basic care and education, and whether they're going above and beyond to support children and their families. So, if you have ever looked at or participated in a QRIS system, a star rating system, or tools like Eckers, you may notice something. Standards and quality are often treated as if they are the same thing, not two separate things. Over time, they have begun to merge, especially for family childcare. And that shift is important because when health and safety requirements are treated as mm, indicators of quality, the system is quietly redefining what quality means. It suggests that running a safe program is not the baseline expectation, but something that has to be measured and rewarded as quality. Now, this brings in the QRIS system, which began appearing in the States in the 1990s. At that time, these systems were intended to help programs move toward higher levels of quality, often by supporting programs that were working toward accreditation. Much of that early focus was on center-based programs. Family childcare, however, has had a quality assessment system since 1994 through the National Association for Family Childcare. This is important context because when we talk about quality in early childhood education today, many systems frame quality through ratings like the systems I mentioned, QRES or star ratings. But family childcare has long had its own system that looked at quality differently. It does it through relationships, program practices, and the unique structures of home-based care. Something that also needs to be addressed is early education. In early education is that for many programs, the relationships between educators and children are not the indicators of quality that federal and state systems are looking for. Instead, these systems are often looking for ways to measure school readiness. And we will be discussing school readiness in a later episode. And like many of the other things we have talked about in this series, it goes back to funding, money. When funding is involved, systems want measurable outcomes. They want to demonstrate that programs are producing results. And once that becomes the focus, quality begins to shift from relationships and care to what can be measured, documented, and reported. So that means that during that time, QRIS systems rapidly spread across the country. And then by the 2000s, many states had adopted them as a way to identify what quality looks like in their systems. But this expansion was also happening at the same time that funding for early childhood programs was being debated and expanded, and at times threatened. Because once public funding is involved, systems need a way to demonstrate results, which we can understand. They want to show that early childhood programs are producing outcomes that justify the funding that they are going to give them. And this is where quality and compliance begin to blur. Because instead of systems focusing on how to support educators in building programs that go above and beyond for children and their families, compliance measures start to increasingly become framed as indicators of quality. So now, and those indicators often become tied directly to whether programs could or should receive funding, even though many of those same programs were also already operating under significant financial strain. So, thank you for supporting my work by staying engaged, sharing, and liking these episodes. I am currently launching a national survey on family childcare educators and their programs. If you would like to help elevate the voices of family childcare educators across the country, please visit my webpage, www.perfectstartconsulting.com, to participate. Thank you for viewing this episode of At Its Roots, Exploring America's Commitment to Childcare. I will see you next episode.